Hello, this is Dr. Anirban Chakraborty again. Today we are going to talk about a very important topic, which is diet for a diabetic patient.
Hello, this is Dr. Anirban Chakraborty. I'm a consultant physician and diabetologist, and I have special interest in lifestyle medicine. Did you know that small changes to your lifestyle may bring big impact to your overall health? I make regular videos to give you tips and tricks so that you can make minimum changes to your lifestyle to have the maximum outcome. So if you are struggling with your health and are fed up of taking medicines, I hope you'll find my videos useful.
So let's talk about diet in a diabetic patient. So when we talk about diet in a diabetic patient, I'm mainly focusing on the type 2 diabetic patients. So I'm not talking about type 1 diabetes patient, but if a type 1 diabetes patient follows similar kind of diet, that is going to help them as well. So I will mainly focus on the diet that we Indians take on a day-to-day basis and essentially try to categorize them into the good bit and the bad bit. So if you are struggling with diabetes and if you understand which ones are the bad bit and you make small changes to reduce the bad bits and increase the good bits, I'm sure you'll see a lot of improvement in your diabetes blood results. First, we have to understand that type 2 diabetes is essentially a condition because of chronic carbohydrate toxicity or chronic carbohydrate excess. So we need to understand and realize which are the foods which are very high in carbohydrate and try and cut them down. So before we understand about those food, let me talk about the different components any food that we eat is made up of. So number one is water, and in general, water is good for everybody. Any healthy person should drink in Indian setting between 3 to 4 liters of water, if not more. Number two is fiber. The fiber is very useful for our gut bacteria that will help us digest food, avoid constipation, and assimilate food better in our body. And fiber will keep us full for longer, and water and fiber combination is almost 0 calorie. So you can have unlimited amount of fiber and unlimited amount of water that will keep you full without increasing your calorie count, and that will help obesity and type 2 diabetes as well. So green leafy vegetables, fruits, these things are very high in fiber. If you look at the grains that we eat, for example, atta has got more fiber than maida, which is more processed. So clearly atta is better than maida because it's got more fiber in it. Similarly, brown rice has got more fiber and white rice is more polished with less fiber. So brown rice is better than white rice. So we've talked about water, we've talked about fiber. Then let's talk about the macronutrients. The macronutrients we have in our food are essentially three. Number one is fat. And we all know what fat is. In general, there's a lot of controversy about which fat is good, which fat is not good, but obviously all of us try to limit fat intake, and therefore I won't go into too much details about fat. Only one thing I'll mention here is the vegetable seed oils are not the most healthy type of fat that you can have. So keep that in mind. Try to avoid vegetable seed oils if possible, especially because if they're reheated, these fats can be quite dangerous for us. So try to avoid vegetable seed oil if possible. Let's talk about protein and carbohydrate. So protein is generally found in any sort of animal food, like any non-vegetarian items, like any meat, any fish, egg has got high amount of protein. Among the vegetarian items, it's a bit of a problem because vegetarian items don't have too much of protein. Out of that, legume or dal, milk product, anything made of chickpeas like besan has got high protein, and any nuts, they are also high in protein. So they are the main source of protein. Seeds, pumpkin seed for example, also are very high in protein. So things like dal, seeds, nuts and milk product are the main source of protein for a vegetarian person. For a non-vegetarian person, the main source of protein are meat and fish and egg. And the rest of whatever we consume are essentially carbohydrate. So out of that, there are two different types of carbohydrate. So one is sugar and processed, ultra-processed food product or ultra-processed carbohydrate like maida. Those are the worst bits of carbohydrate. So you as a diabetic need to avoid them as much as possible. And the rest of the carbohydrates are things which are high in fiber, as I mentioned. Full grains like wheat or oats are better bits of carbohydrates. Remember, all carbohydrates can cause high sugar, so you should try and cut down all carbohydrates. But out of the carbohydrates, you should try and avoid ultra-processed and sugar absolutely. And the full grain carbohydrates are slightly better. So wheat and oats are slightly better. And vegetables and fruits, they also have carbohydrate, but they are mixed with fiber and water. So for example, if you have an apple, you have a lot of sugar, a lot of carbohydrate, but a lot of fiber and water as well. So an apple is better than apple juice, where you get rid of the fiber and only have the carbohydrate and sugar. So completely avoid taking any juice, but have whole fruits, especially the fruits that are not very sweet. For example, berry, avocado, which is not very commonly found in India, but berries are the best type of fruits you can think of. So try to have fruits which are less sweet. Out of vegetables, so the most starchy vegetables are the ones that are found underground. Potato is a prime example. So try to cut down on potatoes. But if you're taking rice and if you're cutting down potato, you're not doing yourself any favor. So potato is almost same as rice. So cut down rice and potato both. So with this background knowledge, if we go through the diet of a normal Indian diabetic person, generally a diabetic person starts their day with tea, with or without sugar. Clearly without sugar is better. With or without milk. Clearly without milk is better. And with or without some biscuits. Clearly biscuit is not good because biscuit is made of maida or something very similar, plus minus sugar. So try to avoid taking biscuits. You can have a bit of nuts if you want with your tea. Then in breakfast, we generally have rotis or oats or cornflakes. All of these are carbohydrates. So you need to try and cut down the amount of roti or oats or cornflakes and increase the amount of either a non-vegetarian protein or a vegetarian protein. As I mentioned, either some sort of paneer or dahi or milk product or egg or other non-vegetarian items or some vegetables in the breakfast. So cut down the roti, increase the vegetables. Then when we talk about lunchtime, again it's the same story. So you have to try to understand that the rice or the roti is the main culprit. And you have to cut down the rice and roti slightly, increase the sabji, increase the non-veg, also increase the dal if you want. Then in the afternoon snacks, again, generally we tend to take biscuit or puffed rice or muri or chirwa with tea. So again, try to cut down those carbohydrate bits and maybe have a bit of nuts or maybe have a bit of chickpeas or chana with your tea. And again, dinner, it's the same story. You cut down the rice and roti, increase the vegetables. So you have to realize that you have become a diabetic because chronic increase of intake of carbohydrate. The less amount of carbohydrate you take, the lesser medicines you'll need. So obviously lesser medicine is obviously good news for you. So try your best, cut down the carbohydrates, increase the vegetables, increase the non-veg, increase the protein intake, increase the fiber and water intake, and you'll see Soon, your diabetes will be under much better control without the need of too much medication. I hope this video has been useful for you. Take care.